Okay, so this is a dark field microscope, so the background is dark so we can see better. Now, I did not put any stain or any chemical in your blood. It is free-flowing just like how it is in our veins.
Okay.
This is 10 times magnification. Later on, we're going to switch to 50 or 100 times so we can see the structures of the cells. These are your red cells. The red cells are the one that gives us oxygen and nutrition.
Okay.
Some of your red cells are on top of each other, which we're going to look later on, go around, which indicates maybe dehydration, possibly poor circulation.
Mm-hmm.
Now, aside from the red cell, we also have these white spots. They are the white cell. They are the ones that that fights infection or allergy. For every 500 red, you're supposed to have one white. And in this frame, if you have 5 or less, it's okay.
Okay.
So let's go. Just need to count here. So I see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 19, and out of 19, 3 are okay, so your total is 19, which means your immune system is producing white cell to fight infection. However, there's an indication that you have some infection going on because our body will not produce extra white cell unless we need it.
Okay.
Okay, now let's go to higher lens. I just need to put a drop of oil on top of the slide. Yeah, what happened? Okay, this is 50 times magnification. Now, these in the background floating around, those are the lipids, cholesterol, triglyceride, or undigested food. There's a bacteria in there.
Okay.
Now, the red cells should be round. If we see red cells that are pointed like this, that is an indication of allergy.
Okay.
It can be food, pollens, chemicals.
Okay.
Also, if we see some rolling ball inside,
Mm-hmm.
that indicates possibly liver stress. Our liver is our main filtering system, so usually the first few treatment that we do here is detoxify the patient, especially the liver.
Okay.
Now also, we see cells sometimes that are abnormal in shape,
Mm-hmm.
which indicates oxidative stress.
What does that mean?
Tennessee is lower elevation.
I think so. I don't know.
Are you
We're
sea
flat.
level? No, you don't know. Oh, anyway, Reno is higher elevation, so our air is thinner. That's
Okay.
why some patients, when they go jogging here in the morning, they have shortness of breath because our air is thinner.
Okay.
Now, this is a white cell called neutrophil. It is a white cell that fights bacteria. And this is a white cell called lymphocyte. The purpose is to fight viruses. So we have to have this to be able to survive. Let me put this in higher lens so you can see the structures of these cells. Okay, now this is 100 times magnification, but I just want you to see this. This is called platelets.
Mm-hmm.
We need platelets so that when we are wounded, the bleeding will stop, but we don't want a lot of those because that's indicate inflammation.
Mm-hmm.
Now you see this looks like circle or bubbles around. That can possibly be candida or yeast infection.
Okay.
If the patient has taken antibiotic or loves sweets, like that, carbohydrates. So you can see, this is the one that we focus.
Mm-hmm.
Okay, let me see if I can. Do you have pets at home?
Yes, we have dogs and cats.
Dogs and cats, okay. Okay, in this frame, you can see it looks like haze or straw. That can possibly be, I'm trying to focus on, it's called fibrins. And fibrins are indication of toxicity. Are you taking any prescription medicine?
Yes.
Okay. So sometimes it's the prescription medicine, and these are all candida. Those are candida. What is your problem? Is it Lyme disease or
Lyme disease, yes.
were you tested?
Yes. I got positive the first time, and then I went from my regular doctor, and then I went to an infectious disease doctor after that, and that came negative.
Okay. You took antibiotic?
Yes, I've been on antibiotics on and off for 2 years now. And the only improvement that I've had of my headaches have gone away, because I was having a headache every single day, but that's about it.
Let me see if I can find any. We saw one Spirochete a while ago. Which test did you do? The Igenex? Or?
No, it was just like my primary care physician, whatever test that they did, and unfortunately I forgot all of my lab work at home. But
Can somebody fax it here?
Yeah, I could probably get that done.
Yeah.
But it was the IgG, IgM.
Okay. Because the thing is, so the doctor can see it, so we will not repeat the test because they are quite expensive.
Sure. Yeah, I have it. My binder, I just completely spaced.
Do you have any co-infection like Ehrlichia, Babesia?
I was never tested until about a month ago when my Lyme literate doctor, and then the nurse called me back a couple weeks later and said that everything was fine, but then we hung up, and they never said anything about the co-infections, and I had been trying to call back all last week to get a copy of those tests, and they never faxed them to me. They just kept sending me to the voicemail, so I never got the results on that. But my first doctor thought I had Babesia because of my headaches.
You can sometimes you can see Babesia because they are like circles inside the red cell. But we can look around. Now this one is a growth of candida. This one. That's how they grow.
Ooh.
Yeah, those are candida. And because are you taking probiotic? Did a doctor give you the?
Yes.
Okay.
Yeah.
So that is candida. These are bacteria inside the cell, but we cannot really say that it belongs to the Lyme because there's some in there here.
The little specks.
Yeah.
Okay.
And then there's we cannot really say what they are because we cannot identify it in the microscope.
The ones that are going crazy.
There, you can see it much better. Trying to focus it. There. It's very hard to see. There. It's wiggling.
Mm-hmm.
Let's see if I can find a good one that is not congested. You can see.
Mm-hmm.
Now this one is possibly a cystic form, which means eggs inside the cell. And
The
sometimes
darker ones.
now these are all red cells.
Oh, okay.
They should be empty inside.
Okay.
But the one of the characteristic of spirochete is they go inside the red cell,
Mm-hmm.
lay their eggs or spores. Once it mature, they come out as baby spirochetes. That's why some of them are longer, some are shorter.
Mm-hmm. The longer ones are older.
Older. Let me see if I can put it in higher lens so you can see. Sometimes we can see they're coming out. Come on.
They're hiding.
I know, it's hard to focus. I don't know why. What time are you seeing, Dr. Fong?
I believe 11.
Now this one is another bacteria. It's round. It looks like a circle with a donut.
The little tiny one.
Yeah, those can possibly be Mycoplasma, which can attack. Oh, there's another one here, which can attack the respiratory organ, colds, sinus infection, coughing, like that.
I'm sorry. What's your first name?
Oh, it's having a hard time. There you go. That's better.
Art. Okay. One moment, please.
See, yes.
Mhm.
See them.
That is that coming out of?
Yeah. There you can see.
Very heavy.
That one is a mycoplasma.
The round one. Yeah.
Did you fly or
I did.
sometimes just the air in the airplane?
So what are the big ones again?
Spirochete.
Or the round, like
Well,
that big round one?
Those are red cells.
Okay. Crazy looking.
They're showing up. Just as it's coming out there. Okay, take a picture of these. Okay, so what I'm going to do is report this to the doctor, and then in the meantime we will be doing your electrodermal screening.